get us started and get us centered, we're going to have Andrew Edwards here give a little talk about some of his recovery journey.
Thank you. And I will do, so I'm Andrew Edwards. I'm a person in long-term recovery. I got clean and sober back in 2014, February, Valentine's Day, 2014. Went to jail that day. So I'll do the best I can to keep it to 5 minutes. Otherwise, Trever can probably throw something at me and catch my attention. So I'll just plan to talk a little bit about, what my life was like prior to finding recovery, what it was like, kind of getting introduced to the recovery community here in Oshkosh, and what life is like today, and kind of what keeps me connected to the recovery community. So I grew up in Omro, started, played a lot of sports, did good in school, in like middle school, early, high school and stuff like that. Had a loving family, pretty normal life, relatively normal, little bit of craziness, a little bit of chaos, but overall pretty good upbringing. And I started getting into like smoking weed and drinking when I was like 12 or 13. That quickly progressed into opioids and cocaine and other things. The progression of my disease was pretty quick. So very quickly my life went from relatively normal, stable life to like lots of, basically everything good in my life started to chip away and started to get cut out due to drugs and alcohol in the life that I was living. Friend groups, changed. Basketball went on the back burner. School went on the back burner. Everything kind of continued to shift. And by the time I graduated high school, I was using opiates every single day, physically dependent on opiates, Oxycontin, and using amphetamines and all sorts of different stuff. So I quickly saw my life go from like pretty good life, pretty normal life, to full-blown, addict, using every day. Couldn't do anything without using, couldn't do anything without drinking. And I never really understood like why I couldn't control it, why I couldn't stop, why I couldn't just manage it like other people that could, in my life. And I always thought that like I just liked, getting really messed up, or liked using more than other people. And I didn't really realize that like I had this thing called addiction or alcoholism that didn't really allow me to control it, or didn't really allow me to manage it, or kind of stop when I wanted to, or control it. So after high school, the next 3 or 4 years, it turned into absolute misery, complete isolation. The party was over. It was no longer fun. In and out of jail, in and out of the hospital, in and out of treatment centers, got kicked out of 3 intensive outpatient treatments, went through 1 inpatient, and I just continued to relapse and continue to relapse. And I never really knew that there was like an alternative to that. I just kind of had resigned to the fact that this is who I am, this is who I'm going to be, I'm going to die an addict or an alcoholic, and that's just what it's going to be. Like that, I was so used to that lifestyle and so used to relying and depending on drugs and alcohol to be and to function and to feel okay, or to feel really nothing, that I didn't really know there was another alternative. So in 2014, I went to jail for 6 months and then ended up in the drug court program in Winnebago County. And that's kind of where, so the topic of this panel is like connection to recovery. And prior to that time, being introduced to like the 12-step recovery community in Oshkosh and all the services and resources, I never knew that this side of the life existed. Like I never knew it was possible for me to get sober and stay sober long term. Never knew what that would look like. So I wouldn't be standing here today if it wasn't for a lot of the resources and the tables and booths that were out there, today, like Solutions and Winnebago County and the drug court program and resources and all these things. If it wasn't for those resources that pointed me to the recovery community and got me involved and held me accountable through that process, I probably wouldn't be, standing here alive today. I for sure wouldn't be sober. And like other people had said, it takes so many tries and attempts to get sober and to stay sober, and it did for me too. So, giving people multiple chances and having resources there available at the right time is so important. Because there's this small window of opportunity that we have when we reach a point and we're separated from drugs and alcohol and we're ready to get better and we're ready to change our lives or make some changes. And if we don't have the resources there available at that time to like scoop us up and pull us in, you know, I'm just right back to the same lifestyle. So, you know, today I've over 8 years sober. Mostly, you know, thank you. And I really owe that to, you know, the resources that initially introduced me to the community here in Oshkosh and the recovery community here in Oshkosh and the caseworkers and, you know, drug court program that kind of got my foot in the door and held me accountable and guided me towards, you know, what long-term sobriety looked like. And for me personally, like 12-step recovery played a huge role. I wouldn't be, you know, up here if it wasn't for that. And fortunately, the Oshkosh recovery community is just phenomenal. You know, I'm married today. Never thought that would be possible. Have a career, have a house, you know, all these things. But most importantly, I feel like comfortable in my skin and feel some peace and freedom without the use of drugs and alcohol. Like, that's the goal. And that's kind of the message that I wanted to make sure everybody knew today is like, people in recovery or people who suffer from addiction and alcoholism, if they get clean and sober, they don't have to live a miserable life. They don't have to, like, you know, hide from life. You know, I live a pretty free, pretty badass life, you know, and it's all due to the fact that, like, I've found, you know, a solution that is more powerful than drugs and alcohol to make me feel right with myself and right with the world. So, yeah, I can't thank everybody in this room enough for coming, for showing support, for trying to help break down the stigma, for, you know, supporting these resources and services. Everybody who's in here, who's involved in services or giving it back, you play a huge role, no matter how small the ripple effect is that you think it might be. It plays a bigger ripple effect, you know, in the big picture. So I have no idea how quickly I just talked, or if that was 5 minutes or not. I talk a lot at like talks for like 45 minutes or an hour, but trying to pack a lot into 5 minutes is quite challenging. So I hope I did all right. But yeah, I thanks everybody for the time and look forward to hearing from the panelists. So thanks.
Thanks, Andrew.
A lot of awesome collective experience up here, a lot of experience with connection to the recovery community. And we're going to dive right into the questions since Andrew took a long time speaking. You know, we're cutting it close here. No. So, Amy and Todd, why don't you start by telling me a little bit about recovery coaches and peer support specialists?
No, these are the same questions he has. Okay, so recovery coaching. So what I love about recovery coaching is that it's meeting another peer at the same level, meeting a person where they're at. There's no power differential. It's based off of lived experience. It's very similar to peer support specialist as well, based off of lived experience. I think there's more of a focus on mental health with peer support specialists. And that was, and I think also too, it's credentialed in Wisconsin. And I know that peer support specialist, was that in 2017 that began, Lynn? Yep, she's in the audience, she would know. She's one of the trainers. But there's really not, I mean, I consider them both to be very similar, honestly, but you do need continuing education hours when you're a peer support specialist versus a recovery coach.
Are there any? Oh, I'm sorry.
Anything to add, Todd?
I would agree with you in general that they are very similar. The difference is the focus. I mean, pretty much peer specialists tend to focus on mental health issues, and recovery coaches are pretty focused on substance use. But what I think is very interesting is the fact that the trainings are really very different.
Oh,
Right? I mean, the peer specialist training is really trauma-informed. you learn a lot about language, but it does focus a lot on mental health. Whereas I think a recovery coach gets some kind of really unique training in the fact that we learn some really neat tools to engage with the people when they first come in the door, you know, and try and assess where they're at in stages of change, and hopefully help them develop a plan to move forward in recovery. So, to tell you the truth, that's where they're alike. That's what they do. They develop the plan, and they hopefully help people move forward in recovery. The tools are just a little different.
Is there a lived experience component to either of those positions, or can anyone have that credential or training?
I mean, lived experience is definitely a big part of it, but I mean, we've had parents that have lost children to an overdose take the training. We've had people with mental health issues take the recovery coach training. I think everybody really has some sort of connection to addiction or mental health in one form or another. So I think it's a beneficial class to basically everyone. I mean, there's a lot of benefits to it.
Can you tell me the various ways that people might connect with a recovery coach or a peer support specialist?
Yeah, so let's see. So I work for Apricity, and we have all recovery coaches and peer support specialists on staff. So even we hire people that are in recovery from addiction to drugs and alcohol, and you can get connected through a coach through there. I'm not going to jump into the ED2 portion of this piece quite yet, but that's probably my biggest passion, how to connect someone from the community to a recovery coach. Also, I mean, being in our sober living houses too, you get connected to a recovery coach. And
I think interestingly enough today, we just so happen to have a lot of recovery coaches and a couple of booths out there that are loaded with business cards. You know, grab information before you go so that you can make those referrals. Keep them for yourselves. You never know when you're going to need them or pass them on, right? A lot of organizations today, a lot of agencies in the community are aware of recovery coaching. Sometimes we actually have to ask for it, though. Kind of remind them that peer support is a thing now. So, truth be told, if you talk to your counselor, they can get you in contact. Sometimes they need a little help doing that, but we have a 24-hour hotline for our organization that you can call at any time, 920-345-7747. Again, it's on the card. And we have a recovery center in Appleton, actually, at 500 West Franklin. Walk in the door anytime between 9 and 5, sit down with a recovery coach. No appointment necessary.
And doesn't Solutions have some kind of a program as well where they can be connected to a coach?
You're asking me questions?
Yeah.
No. Yeah, so we do have a couple recovery coaches on staff. Many of our volunteers are recovery coaches as well at Solutions. So, you know, the hours are kind of all over the place, but we try and have somebody there every time we're open, 9:30 to 8:30, and it's getting more and more as the resources become available for us to be able to provide that. So you can also call us or find us on the web, and we can help connect you to a coach that way as well.
Threw you that bone.
Thanks. Appreciate that.
You're welcome.
Okay, Amy, I'm going to have you hand your mic over to Tim since they didn't give us one for him.
Hey,
so
I'll tell you what, Trevor, real quick. Coaches in the room? Coaches in the room. Thanks.
Thank you. Tim, you saw a need for this type of support in the community. Can you and Todd tell us a little bit about the MCAP or Menasha Community Assistance Addiction Assistance Program?
Yeah, certainly. It's something we actually started looking at doing in 2015. My community liaison officer at the time, a guy by the name of Aaron Zemlock, came up with this idea of, is there a way that we can get resources to folks, because we interact with folks in the community all the time. Sort of fell and came dead apart and didn't really work until 2019. This was probably one of the best things that ended up taking place with it. Our health director at the time, Nancy McKinney, ended up coming across some grants that would do this exact thing for us. So when she approached us, it was like, yes, we wanted to do this a few years ago. We know the need, we see it. But what was really good about it is being speared outside of the police department, it really became more of a community side of it. So we not only trained the police officers, we trained Gold Cross, we trained the firefighters, basically people throughout the entire city. And that was important for two ways. One, it really did what we're trying to do here today with this event, breaking down that stigma. Really trying to make people think about folks in our community that we're interacting with on a daily basis in a different fashion. How can we get them the resources so we can hopefully avoid an overdose or a death? That was the one important part of it, and then really just kind of refocusing and getting those resources out into the community then. Working with Todd and his group was just absolutely phenomenal because the way that our program works is very simple. Anyone in the city who comes across someone in our community that we recognize that is having an issue, we just give them a card. It's that simple. We might pass on a name and number to Todd and his group, and Todd reaches out to them, and sometimes fairly relentlessly, is Jack one of the big guys in the room here that is doing a lot of the work for us, and makes that connection. As a result of that, what we have seen is a huge reduction. We have not used Narcan and Menasha at all this year. Where every other community in Winnebago County and the Fox Valley had an increase in deaths last year, we fortunately had one, unfortunately. One still way too many, but where everyone was seeing an increase, we've seen a decrease. I can't unequivocally say that it's because of Todd and his guys' work, but I'm going to say it was Todd and his guys' work. Getting people connected to it, and we're trying to do it, as we like to say, left of bang. We like to do it before there's the overdose. When we're there on the welfare check, and we recognize the reason why we're there because the kids were running around the street is because mom or dad was high. Okay, might be a social service thing. We're not about arresting. We know that we're not going to arrest our way out of this. Instead, hand off the card, get Todd and his folks involved with it, and let them work their magic. The other thing I'll say on it is, the other thing I think works really well with it is, as much as I could have a conversation, a firefighter could have a conversation, a health nurse, I can't speak your language. I haven't lived that life. Him and Todd and his group using coaches that have lived it, that shared experience, you guys can talk a language that we can't. As much as I want to be compassionate to it, I haven't lived it. And having people that are trained in it and understand it and can leverage that is just a phenomenal program. So I'll kick it to you to what you want to throw in there, Todd.
Well, thanks. First of all, a lot of this actually comes out of the rooms, the support meetings that have already existed, right? We were doing that exact work. We're talking that language in the rooms of AA, NA, all the programs that have been out there for so long. The real question is whether or not we could empower the people inside of those rooms to go out into the community and do the work. So that's where recovery coach training and peer specialist training and things come in, because now we have some kind of credibility. And, we have community partners like Menasha that reach out to us and say, how can you help us? That has been a blessing, because to tell you the truth, if we as a recovery organization were to apply for that very same funding, we would not have gotten that. But the fact that it came from the city of Menasha, the funding was received and was passed through to the recovery organization. And man, did that grow this whole effort of ours, So, you could call that breaking the glass ceiling for people in recovery, so to speak. It's been a wonderful partnership, and the fact that Nancy did as much hard work as she did up front for us, that was awesome. But the way that it has worked out and transpired, we're at 140-ish referrals, and a lot of those people, we have to reach out and meet them where they're at. They're still ripping and roaring sometimes, right? So all you can do is reach out and say, hey, if you want to talk, we're ready to talk. Get down and meet them where they're at, and sometimes it turns into something much more. And you might say, well, 50%, not the greatest success rate in the world, but in the rooms and in the world of people in recovery, we know that's pretty good success because we haven't seen those kind of numbers with the old, treatment paradigm that has existed for so long without any kind of peer support. So it's just been, I don't know, we kind of took a chance and went full in. We didn't, come up with a whole lot of policy and procedure. We just started making calls. And Jack started chasing people, and that just seemed to have worked out for us really well. And nobody
We
has
haven't
said
had to
go away.
arrest him yet for chasing people, though, so it's all good.
No, it's been super, and we're very fortunate to have some really good volunteers that have been able to do good work. It's a question of shaking your head when they're telling you what's going on is really where it starts today. And if we can do that and build some trust, and that turns into a little more information. I mean, let's face it, we're all recovering from something, right? And most addicts and alcoholics chose not to take the right path to recover from whatever they needed to. And today they're dealing with a second issue. So if, for instance, we can get them to speak and talk about what that trauma was years ago, now we're at the root. And now we're really helping somebody. And we're getting to do that work. It's really cool.
Yeah, thank you. I think, the partnership that I've seen between your two organizations is phenomenal, and it's something that's really needed because we need to work together as a community to make this work happen. And the broader community, seeing that the recovery community, whatever recovery community it is the best support for somebody struggling with that substance use disorder. It's somebody with lived experience, like you were saying, that can talk that language and say, hey, I've been there, I can offer you that hope. So I think that's really great. Thank you for that. Amy, can you talk a little bit about the ED2 recovery program and how people might get connected to recovery coaches in hospitals?
Sure. So about a little over a year ago, first I want to give props to Sharon and Jack because they're on the ED2 team. They're great. They are great. So it stands for Emergency Department 2 Recovery Plus. So they added the plus, meaning going more into the community, not just emergency departments. Wisconsin Voices of Recovery are the grant holders of this program, and this was since 2017. And Theta Care got a grant and asked Apricity and Apricity's coaches to take on and partner and come to their hospitals. So we're working with 7 Theta Care hospitals, and we recently also partnered with Ascension, so another 3, and talks with some others. Then where the community comes in as well, we're also working with behavioral health, like Theta Care Behavioral Health. If they're an IOP and somebody's relapsing and wants more support, they can get connected to a coach. We're connecting with treatment centers. When a person's discharging from treatment, get them connected to a coach so that, diving back into the world isn't as scary, and they have somebody cheering them on and guiding them along the way. We're getting into the OB clinics, MAT, medication-assisted treatment clinics out in Wapaka. And so, there's a lot of people reaching out for recovery coaches in this program. But how it works, we have 2 to 3 people on call 24 hours a day. When the hospital calls, we have 1 hour to get there, and we get to meet the person where they're at. We get to say, hey, I don't work for the hospital, I don't work for DOC, I'm just like you, you got time to talk. Do you want to hear a little bit of my story, And sometimes they want to talk, sometimes they don't. That's totally fine. Sometimes they'll call 2 months later. So, you know, and we have the opportunity to meet with these people for up to 18 months following that. So I can say, like so originally this is for opiates and stimulants. I know I'm jumping around a little bit here, but so this is for opiates and stimulants. We do see the need for additional help with alcoholism for sure. It's a huge problem at the hospitals. And kind of how we're kind of navigating that is if we can find something in that patient's history where they may have abused some kind of a prescription 20 years ago or tried meth once or something, then we can get in there and hopefully provide some of our recovery coaching services. And it's not about us, it's about them. It's about what they want. It is their journey. If they're not ready for recovery, great. I'm here to support you. I'm here to listen to you. I'm here just for you. You know, and it's pretty cool because a lot of people are like, wow, I don't really have any sober people in my life to talk to, or, you know, I could just use someone just to talk to. And it's like, well, I can totally do that too. And eventually it can turn into something different. But yeah, so we basically meet people, link them to resources, continue meeting with them, educating them, providing additional resources, and maintaining contact with them. And the goals of this program are to decrease the number of overdose fatalities in Wisconsin, increase treatment and recovery support service utilization to the target population, reduce ED admissions due to overdoses, and provide peer support in community settings.
Great, thank you.
There was a time where on my recovery journey, I didn't want to talk to anybody in the Angels in Blue. And but now it's such a huge part of recovery and that communication. And though there are still many in recovery community that I know that are profiled or maybe and experience issues with officers, and that's okay, but we work to become and just set an example, and we try to bridge that gap. So that's a huge partnership between law enforcement. And you know, there's a time where I feared the MEG unit, but now I love the MEG unit, you know, and I want to acknowledge and admire your compassion for recovery community, and I think that's beautiful. I'm just curious, is there something, was it personal, was it your spirit, what compelled you?
That's a great question. When you heard my background isn't traditionally law enforcement. I'm a business guy. I went for business degrees, whatever, so I've really kind of always looked at myself as being an outsider in the law enforcement community. So I've always challenged the status quo. And probably my biggest first epiphany was when I went through crisis intervention training, CIT training, 15 years ago. I had thought of, like what you're saying, you know, the stereotypes, your implicit biases. You're a bad guy. They're using drugs. When I went to CIT training, it was like an epiphany happened. I all of a sudden realized that these aren't bad guys. Oh my God, this person's suffering from schizophrenia and self-medicating. That's why we're dealing with this one. And all of a sudden it was like, holy cow, we can deal with people as people and not just arrest our way out of a problem. So when we started looking at it from that terms, and then being in the position that I'm at now, I fortunately have that influence to be able to spread that message to our folks who are buying into it. Because let's face it, we'll arrest you today, we'll arrest you tomorrow, we'll arrest you 3 weeks from now when you get out of jail for having drugs again. Or we could say, no, we need to help this person out. What are the ways that we can connect them with resources? Does it mean that we don't arrest people for drugs? Of course, you know, there's a time and a place for that. But it's not our first choice to it. So for me, it's really just been a passionate thing of changing that definition of insanity. We can't continue to do the same things over and over and over again. And so long as we can recognize and see people as people, put on your pants the same way as me and as everyone else in this room. And that's what we have to make sure that we continue to do and treat people with that respect and dignity across the board.
Other questions?
So this is a two-part question, one for the chief. I commend you for really thinking outside the box. I do a lot of work with law enforcement now, so I'm blessed that I can work with law enforcement, because at one point I used to wear your beautiful jewelry, but I don't know anymore. So I'm from the Green Bay area. I also work for HSHS. I work on a HRSA opioid grant in 5 northern counties. But do you have, I know you talked about your mental health officers or behavioral team, but do you also have licensed clinical social workers on your department? And also, I've heard a lot of great organization names. I know Amy, I know Todd from Apricity and Solutions and Prism. They do amazing work. But has the police department in itself considered looking at employing a recovery coach or a certified peer specialist to work in tandem as a liaison with all these amazing organizations that are out there?
So I heard two different things in there. One is more from the mental health perspective, having an embedded person within. There's been discussions, when we look at our call volume and the number of folks that we deal with, specifically mental health crisis, we probably couldn't support or justify that. However, we've looked at it in more of a regional fashion from that side of it. So that's kind of a thing in progress, and we a variety of different programs that we have that I could probably spend an hour talking about. So not from that side of it necessarily. Now, bringing in a peer support specialist or a recovery coach, I don't want to, because I want to have that division. We could, and we obviously work very closely with Todd and his group, but let's face it, as some of you folks have mentioned, there's that mistrust, especially when you're using. I want to be that bridge to getting people to that resource. I don't want to be that barrier. One of the things that we haven't fully implemented with the MCAP program because of COVID is the follow-ups, like Jack has gone on. Jack has sometimes gone on those follow-ups with a police officer. Sometimes we've been able to get him in the door, and it's been very successful, which it wouldn't have happened if the cop wasn't there. But we also want to do it with other community members. We want to do it with a health nurse. We want to do it with a paramedic. We want to do it with a firefighter. Because let's face it, you might not hear it from me, and you don't want to say a word to me. But maybe if I bring a firefighter, everyone loves firefighters, right? So maybe bring a firefighter with, and they'd be wanting to talk there. So the very long answer to your question is no, and it's by design, because I really don't want to have that mistrust and have that be the barrier to a person getting resources. Might that change in the future as word gets out that law enforcement is trying to work in tandem? Perhaps. But right now I think that's the good fit, because I don't want to ruin that trust.
Okay. Thank you.
I think there was another question in the same row down there.
I'm wondering how much follow-up do the peer recovery coaches do? You encounter someone, you maybe talk to them a little bit. How much follow-up is there with a person that you encounter? And also another thing, there's so much connection between, there's a session going on right next door between addiction and mental health issues. How do you make those referrals when you see that there's more going on there than just, you know, something that you could handle maybe?
Well, okay, the first part of that question. Oh, yeah. So we contact our peers if they're willing, if they say, yes, I do want to hear from you, and they give us their phone number. We try to reach out to them every day of the week or ask, what are you comfortable with as far as us reaching out, maybe 3 days a week. Eventually, it spaces out and there's further. Some people need more of your time than others, and that's totally fine. I usually try to go out for coffee or something with them at least once a week. And the mental health piece, I myself have struggled with mental health, and that was a big part of my own recovery. So sharing that piece with a peer, whether it's helpful to them or not, but I mean, you're on the same level with them, you're building trust with them, they're going to hear what you have to say and maybe think about it. You know, I mean, there's tons of resources for mental health, and all I can do is share what has worked for me, and if that's a path that they want to try or take a step this way or a step that way, that's totally up to them.
That's one of the beautiful things I think about, peer support work is, everyone has their own individual path. And we could, for instance, get a referral and follow up with them on a very regular basis. And if it wasn't a correct phone number or something, we're not going to even be able to make contact with them for a while, but we keep trying. Sometimes we can reach them through family even. We make an effort to do that. And there have been times, too, where we've not been able to make contact, and guess what? We get that phone call in about 3 months, right? Saying, okay, maybe I'm ready now. And then the question is, we sit down and say, well, what does that mean? What can we do for you? Does that mean you want to talk on the phone once a week? Can we get together once a week? For some people, it means help me find treatment, and it could be either substance use or mental illness. That's the nice thing about having coaches who are dually trained, is the fact that we tend to know most of our resources in our community better for both mental illness and for substance use. So I guess the best way to say that would be, as we build a person's individual recovery plan, if, let's just say they're even still using, and they're in some kind of a harm reduction mode, okay? If they someday say that they actually want to take the big step and go into treatment, if there's a walk-in clinic, let's walk in there together and do it now, because the window of opportunity always closes if we don't act right away.
Yeah, thank you for that. And I think that's really important when you bring that up, Todd. It's like planting the seed, letting people know that we're here, but just treating them with dignity, respect, and love. That's something that we're able to do as professionals and as peers, allowing that connection to take place and letting people know that the door is open when they're ready. So thank you all, panelists. Thank you, Andrew, for grounding us and bringing us in here. We're going to take a 15-minute break while we expand the room again, get something to drink, get some refreshments, whatever, use the bathroom, and then let's give our panelists and Andrew a round of applause.